Hey, I'm Mark Murray. I'm a family doctor here in Boone. I know a lot of you, but not everybody. I've been here for 25 years doing primary care. I'm a solo practitioner. I have a nurse practitioner, PA, clinical pharmacist working with me. We're independent, small business, employing 10 full-time employees. We provide healthcare benefits and a pension and other benefits. We pay taxes like everybody else here on the order of, 40% of our net goes to pay taxes and state and federal taxes. So I feel like I am invested in the community and in these issues based on those factors. But I'm here today speaking on behalf of the people that I serve, which is the patients in my practice and in our community. One of the biggest challenges that we have, whether people have insurance or not, is trying to figure out how to affordably take care of them, both in diagnosing and prescribing and evaluating things. Even if you have health insurance, it's still a challenge. But if you don't have health insurance, it's almost impossible to have quality health care. There are stopgap measures. Watauga County does a great job. We've got the community care clinic. There are institutions. There are places that people can have access. Yes, you have access. You can walk into the ER anytime. That doesn't solve the dilemma for people about getting good quality health care. I think that's an obvious point, but it's worth stating. One of the things Kathy asked me to mention was if I had, sort of patient experiences with affordable care, and one in particular came to mind immediately. There's a fellow that I've been seeing for years. He's in his mid-50s, mid to late 50s now. And he would come in, he had no health care insurance. He'd been working for 20, 25 years in light industry up in meat camp. They did not provide health insurance for him. He would come in, for episodic care, when he had an acute problem, and we would try to address his chronic needs at that time too. He was, just because the way he was born, he was overweight, he had diabetes, he had hypertension, he had hyperlipidemia, all of the sort of usual constellation of things that happen to people in America. He would get medicines, as cheaply as we could, but things were not really going well for him. He developed sleep apnea and then atrial fibrillation due to that, so he was in a pickle. He did get on the Affordable Care Act insurance, and he came in and said, hey, I finally got some insurance, let's take care of this. And we put him on appropriate medicine, and he did well. He came back a year later. He had lost, because of the medicine he was on and the way that we were able to monitor things, he got a little motivated. He was able to lose 50 pounds. All of his medical conditions went from being absolutely uncontrolled to absolutely perfectly controlled. That Affordable Care Act saved that man's life. It cost, between his sleep apnea treatment and the medication treatments, it was costing about $500, $600 a month for his treatments. That equals about one trip to the emergency department that he'd have access to, if he did not have those things. He came in and he said, this is saving my life. What, he said literally, what am I going to do if they take away my Obamacare? And I just, I couldn't tell him the truth on that. I said, man, I don't know. But I do know. In a year, he'll be back where he was, because it was taking the treatments to make him better. And that thing gets played out a million times. He's probably making $30,000 a year. His insurance, if he had to pay for it out of pocket, it's going to be $1,000 plus per month. There's no tax credit plan that's Ryan's plan for tax credits as the repeal and replace option, there's no tax credit that's going to give him $1,000 a month. That's just not going to work out. So I support the Affordable Care Act. I'm not even real sure what all the complaints are about it. You know, everybody's saying, oh, it's a mess. I really haven't seen it be a mess. I've got many other patient experiences where people had great experiences. You know, as a small business owner, we were having double-digit increases in our health insurance plan in the office before the ACA. That is actually moderated. We've had much less increases over the past few years than we had before that. I don't think that's really related to the ACA, but over time, it could if everybody gets insured. President Trump's executive order to not enforce or instruct the IRS not to enforce the penalty for the individual mandate has already started to undermine the program, so it's already being dissembled. So I hope that we can exert some pressure to keep what we've got. You know, my eventual hope is that we'll have universal health care and a single payer at some point.